My guy's flying. They just got an H, which is worse than F.
When Daniel Beard's mother wants him, this is the first place to look, in front of the TV set playing his GameCube.
246 again!
Yes, he will play it 24/7 if you would let him.
I kind of like video games.
He's also big on sports. At 7, he's been on a swim team, baseball team, and soccer team. His favorite?
Basketball. My favorite sport.
It's pretty much just running back and forth in the court with the ball in the hands, but, they enjoy it.
Daniel does well in school.
He likes school. He likes the work.
And he likes to play with friends.
He's actually a really social little boy, and so he has a lot of friends, I think, and he gets out and plays.
Daniel is staggeringly normal, if there is such a thing, except that he was born with a frontal nasal dysplasia and a frontal nasal encephalocele. He was 2 days old when his parents took him to the Craniofacial Center at Seattle Children's Hospital for evaluation.
As an infant, he had a fairly severe craniofacial abnormalities. His eyes were too wide apart, and he had what we call like a midline cleft in the face, so the face develops in two halves and moves together, and in Daniel's case it didn't get all the way to the middle. So the two halves of his face were separated. His nose was sort of double, and he had a big hole between his eyes where the brain was herniating down from the cranial cavity through a big hole in the base of the skull. That's called an encephalocele.
That doesn't mean he wasn't cute. In fact, he was an adorable child.
You're just like, oh, he's so cute,
But with part of his brain coming down into the top of his nose, there were some serious health risks involved. An encephalocele leaves the brain unprotected.
They can lead to central nervous system injury, primary injury of the central nervous system, so brain injury. They can also be a way that the central nervous system can become infected through the oral or nasal cavity. So repairing that skull base and putting the brain back where it needs to be is a very important first step.
It was kind of scary because you don't know what's wrong with him, and it's up by the face and it's up by the brain, and you don't know if anything's wrong in there.
Daniel had just turned 1 when he had his first surgery. 2 surgeons working together sealed off the opening in his skull. His sister Anya's earliest memory of Daniel is seeing him come home from the hospital.
I think it was like right after his surgery, and he walked in the store and he was just like so happy and he just kind of waddled in. It was really funny.
I remember that.
And so Daniel grew up for a few years, waiting for the right time to have his second surgery, when the upper part of his face would be fully grown. Dr. Cunningham kept track of his condition.
Most children really don't become very aware of their facial difference until they're about 5 years old. But I'll tell you that those first 5 years, the parents are doing nothing but worry about what the impact is going to be for the child.
The part that was kind of scary wasn't so much the way he looked, but the concerns: would it impact him, how would it affect his brain, what would his abilities be.
They were worried about how he would be when he grew up.
Do you want to take one?
So I'm very upfront with families. I bring it up if they haven't brought it up themselves. And as you can see, meeting Daniel, there's no cognitive problem with Daniel whatsoever.
Do you remember Dr. Cunningham, Daniel?
By the end of first grade, Daniel was physically ready to have his second surgery. To his doctors at Seattle Children's Hospital, Daniel's emotional readiness was equally important.
I have a question.
Yeah.
Will I get to pick what my nose will look like?
What Dr. Gress is going to do is try to make your nose look the way that he thinks your nose was meant to look. Does that sound right? Yeah. We are talking about a surgical procedure that is going to change the way that they look, and we need to know that the child themselves are interested in moving forward. Your face is so close to normal, it'll be pretty easy to make it good, right? And Dr. Gress this time is going to do a few things, I think, to make it so that your eyes are a little bit closer together, and that your nose is going to have, instead of having 2 bumps on it, it's going to have 1 bump right in the middle, and that's going to change your face a lot.
Daniel was ready. For one thing, he was tired of questions from other kids.
They'd make comments, or why do you look like that, or, what's wrong, or, and I noticed, I think when it was in kindergarten, or maybe in daycare, someone said, you look like an alien, because that's what they would relate it to. Can you smile?
Smile. Good job. And look at me and be serious, no smile. There you go. Perfect.
How you doing, big guy?
On clinic days at Seattle Children's Hospital, patients stay in one exam room for all their appointments. The doctors come to them.
Tomorrow you're not going to be able to eat, so you better eat tonight.
Do we have some pizza?
They usually have it scheduled kind of sequential, so we might start off with Dr. Ellenbogen, then see Dr. Gruss, then see the ear, nose, and throat doctor. We might see Cassie from social work, and then Dr. Cunningham may tie everything up at the end of the day. Did you have any questions about pain afterwards?
They can see as many as 8 different providers in a single clinic day, spending most of the day with us, which really facilitates communication between team members, and I think improves the care of the patient.
All I'm going to do is just listen to your heart and look in your eyes and a few things like that, okay? I'm not going to do anything that's going to hurt you. Does that sound okay?
Daniel had several appointments on the day before his surgery. As is the case with all patients at Children's, a multidisciplinary team was involved in his treatment.
Seattle Children's Hospital has an enormous team dedicated to craniofacial medicine. In that team are pediatricians, developmental pediatricians, geneticists, pediatric geneticists, social workers, nurses, orthodontists, dentists, otolaryngologists and head and neck surgeons, plastic and reconstructive surgeons, and neurological surgeons.
You see that, Daniel? That's the inside of your skull there.
Team members bring expertise from a range of specialties, which combine to offer a more comprehensive treatment plan than any individual could do.
You can really give patients the state-of-the-art care, because today in modern medicine, you can't know everything about everything. So an eye doctor knows more about the eyes than I do as a plastic craniofacial surgeon. So we all bring our expertise to bear on the problem, so the patients get the value of having multiple experts looking at the problem and trying to work out what the best way is to fix it.
It's very clear they've already discussed the case together, which is helpful because they're all on the same page, they all have the same plan, as well as in their staff.
He'll be able to swim as soon as he heals up, probably.
Daniel's team has been following him all his life. His care has been coordinated by his pediatrician.
But if something comes up when you go home tonight and you want to talk about something, you let your folks know, okay? And they can call me. All right? All right. I'll see you.
Daniel's doctors have collaborated on the plan for his operation.
We have these incredibly sophisticated CAT scanners and that gave us a beautiful detailed view of all the deformities and helped myself and Dr. Ellenbogen plan the operation.
Here we have the large, broad-based nose, that is the abnormality, and you can see how widely spaced his eye sockets are. And our plan was to remove all of this and the orbits to repair the hole that's on the bottom of his skull.
It's a very, very big operation. It's one of the biggest operations we do in craniofacial surgery.
The plan is very straightforward, although the operation itself was very complex, and that is to remove the front of the skull bones here, to remove the orbits, and then move them together. So the goal of this operation is threefold. One is to repair the deficit at the base of the skull. The second is to safely move the orbits together. And the third is to fix the deformity of his nose and eyes superficially.
We have a combined approach from the head and from the face, and the risk of this operation is damage to the brain and the eyes. So because I have to cut the two halves of the face separately apart and then bring them together. And we have to make sure we don't damage any of the important structures in where the brain is close to that and where the eyeballs are.
Hello, is Daniel Beard in here?
All this has been explained to Mark and Jennifer Beard, and Daniel had his own pre-surgery tour, so he'd know what to expect tomorrow.
So the big thing to talk about is the plan where you're going to go to sleep. There is actually this medicine called Goofy Juice, or more formally called Versed. That medicine is very helpful.
I think they showed me the room that I was doing the surgery in, and I think they showed me where I'd be. Like, I have a question. Did they move me from a room to another room?
They did.
the room that they like put me to sleep in.
And then the one you're going to go to where you're going to have your surgery?
Yeah.
Children's has a great way of having this process go on. It allows kids to ask questions, but it also educates us as well.
Yeah.
and many of the questions we may have had that we were afraid to ask or may felt funny asking, he may have asked, or we may have asked at some point along the way and gotten those answers, fairly easily. And everyone's been very good about saying, do you have any more questions? Is there anything we can answer, or any other information we can cover for you?
The next day, when Daniel had his surgery, he knew what to expect.
You brought him. Did you sleep with him last night?
And having a Game Boy to play with was the perfect distraction for a video game addict.
It really helped relax him a little bit, and if you remember, he kind of fell asleep playing it.
Here we go. It's got a little cherry flavor to it.
Goofy Juice from the anesthesiologist also helped Daniel relax, once he got past the taste.
Yeah. What do you think of that?
Yeah, Daniel, not so good.
As he was taken to the operating room, he was still playing with the Game Boy. It was the beginning of a 9-hour wait for Mark and Jennifer.
You will pick up a pager from the intensive care unit, and any update information, every time your pager goes off, go back to the intensive care unit. Okay. And Dr. Ellen Bogan will see you after the surgery.
At home with her grandmother, Anya waited too.
Because I'd called my parents, and then my parents would call us.
You're just wanting to know everything's going okay, and he's going to be out all right. Things they do that are great is they call, and they tell us where they are in the surgery, how it's going, is it going according to plan.
But he has good thick bone there. He's got. I'd like you to take a nice big piece so we can get split some.
So split some bone and just lay it down.
Yeah.
The craniofacial team performs as many as 100 of these surgeries a year.
I feel very gifted in that I have one of the greatest living craniofacial plastic surgeons, Dr. Joe Gruss, and one of the smartest craniofacial medicine doctors, Mike Cunningham, as partners. And we sit down and come up with novel and innovative techniques to repair these very unique abnormalities. Every patient brings with him or her a different set of problems. So the key of this team is the creativity and the ability to change the plan based on the patient's specific problems.
There we are. So you can feel for the lateral orbit.
Yep. Today, Dr. Gruss starts by separating Daniel's eyes from the surrounding tissue and bone. Eventually, Daniel's scalp will be peeled down over his face so that his surgeons have access to the orbits, which are the bony sockets around his eyeballs.
When you make the cut around and you move the orbit this way, the optic nerve intracranially is the right width.
The orbits are moved closer together. While this is going on, the surgeons have to take care of the encephalocele.
What that is a tongue of brain that kind of herniates down between his eyeballs. Okay, so we're going to have to lift that up and move that in and preserve that brain while we're moving his orbits.
Earlier, to prepare for restructuring Daniel's face, Dr. Ellenbogen removed a piece of bone from the front of the skull.
The skull has two layers, so what we're actually doing is taking bone from the inner layer of the skull, so we could use that to do the reconstruction.
This will be split in half, using one piece to cover Daniel's brain backup and the other to seal off the bottom of his skull where the hole was. Titanium bands will be used to hold the bones together. The surgical team has performed this operation many times together.
There's a precision to it, and there's also a ballet element to it. Everybody knows their job in place. One person moves in, then the other person moves out. People are helping each other, and it's much more complex than the Nutcracker Suite, I can tell you that.
In the Northwest, this particular ballet can only be performed at Seattle Children's Hospital. It takes a very specialized center to do it safely.
Our program is looked on as a model for craniofacial programs around the country. We're looked on as the model program.
Daniel's family would agree with that.
As soon as he came out of surgery and he was in intensive care, and even though he was sedated and had a cast on his nose and everything, I just looked down and went, wow, it's incredible what they did. you know, and you know, we still didn't know exactly what he was going to look like, but I mean, it just was incredible, the difference.
The surgery actually went perfectly. It went exactly as planned. Here you can see the repair of his orbits and his skull. So now his appearance is absolutely normal. We took a piece of bone from the left side of his skull. We split it in half like an Oreo cookie. Put one piece back to cover up his brain. And then we used the other piece to seal off the bottom of his skull where the hole was and rebuild his nose.
Most important are the health benefits.
His brain is now protected. There's no hole from his nose leading to his brain. And he doesn't have to worry about meningitis or any of the other complex problems that can happen to children that are untreated.
Daniel can breathe better too.
We can sleep through the night and not hear him. His bedroom's across from ours, and probably for the first 7 years, we've heard him snoring, loud noises, kind of as he's breathing. His nose is completely clear now, and he seems to be very comfortable breathing at this point.
And then, of course, there are the social benefits.
We had friends who hadn't seen him since his surgery, and afterwards, you know, we were in different places where other friends had, you know, were seeing him for the first time, and many were just amazed at kind of the difference in what he looked like and the changes that had happened from kind of pre and post-operative levels. And I mean, one person was just floored. He just like stood and stared at him. He was like, "Wow, this is just incredible! I can't believe what they did."
Happy birthday to you! Cha-cha-cha!
Daniel's friends have taken his new face in stride. He's still just Daniel to them. But at first, he had a few concerns of his own.
Well, I think he also had a little bit of a challenge getting used to what he looked like. I mean, any of us, if we woke up one morning and looked in a mirror and we looked different, and having to kind of become accustomed to that and adjusted to that, and that this is now my new personality, so to speak. He, you know, the first week or two coming home, he didn't want to look in the mirror in the bathroom. He didn't want to look in any mirror in the house. It probably wasn't for a good 3 to 4 weeks before he would willingly look in a mirror.
Eventually, Daniel did look in the mirror, and he liked what he saw.
Good. I like it.
Yeah, I think it looks really good. I think they did a good job.
That's a good picture.
There may be some additional surgery as Daniel gets older. The underlying bones of his jaw will continue to grow until his late teens, so some touch-up work might be necessary.
Somebody like Daniel will be with us until he's 19 or 20. So, you know, we get to know the family, we get to know all the kids.
I definitely will continue to see Daniel, as will all of the members of the team that have been involved with his care. We'll need to make sure that everything continues to go well for him.
Oh, I went too far.
I'm forced, yeah.
And as Daniel grows up, he'll continue to be part of the team as well.
I think is a really good result for Daniel, and he's really pleased with it. And I think he would do it again. I really do. And I tell you what else, I think that if they have to have more minor surgery, he'll choose to do it. You know, which is, at some point, is really completely his choice, I think. It's his face and his life and his choice.
Oh, smashed Sonic, smashed another. I'm catching up on you, Dad.